And radiation treatment can truly have an impact on...
Absolutely. Whenever we can find a cancer early enough that surgery might be able to remove all of it, that's the ideal situation. But all too often, it's not until a patient has symptoms,
right.
and many times by the time they've had symptoms, the disease has advanced to other areas.
Mm-hmm.
Fortunately, radiation can treat a lot of areas that the surgeon can't reach effectively without a lot of risk or side effects. So
right.
we can treat more advanced cancers that surgery can't.
Mm-hmm.
And there is one area where particularly we've found that by combining often together at the same time chemotherapy and radiation so that they're working synergistically,
right.
each one adds to the effect, both beneficial and side effects, but the end result is that we can get a much better control rate, much better cure rate if we can combine our best tools together to work simultaneously.
Very interesting. I was fascinated to see that the Carolina Regional Cancer Center, a sidebar there, is the first radiation oncology facility in the state, accredited by the American College of Radiology. A little different. Just review, I mean, that's a big coup there, it sounds like.
It really is. The American College of Radiology is the national organization essentially oversees the training and the qualifications and requirements for quality radiation, whether it be radiology for diagnostic purposes, right. CAT scans, x-rays and so forth, or radiation therapy or radiation oncology for treatment. And taking the step to get accredited is right. not required yet, which is probably why a lot of places haven't. But we realized that it was, it distinguished us, put us a step higher where we felt we really were,
sure.
and gave us the recognition for that. But it took about 2 years of effort. They had to review all of our physics and dosimetry and simulation treatment machines, as well as physicians, our following a minimum level of quality assurance to make sure that we were documenting and treating patients appropriately.
If a viewer needs to get off to work now or get family out of the house, Dr. G, what's the best? Do you all have a website or a phone number for a viewer to go online to learn more about Carolina Regional Cancer Center?
Yes, absolutely. We've worked hard on trying to get a good website that helps patients to learn more. And patients are starving for information because suddenly they've got a disease that's very serious and potentially life-threatening.
Yeah.
But www, of course, crccmd.com.
crccmd.com. I think you mentioned a good phone number. If someone doesn't have internet access, they can call just to find out a way to get some more written information. 449-9415?
9415.
Okay,
that's right.
9415, 449-9415. They can call and ask, can I get some written information? Or surely go to their public library and go online if they don't have internet access, crccmd.com.
And the American Cancer Society is a good resource as well.
Great.
And their office is right on the corner of 48th and Grissom Parkway.
Very close to y'all's office.
That's
Speaking
right.
of that, you are located off of 48th Avenue on Oleander.
On Oleander, 4708 Oleander. So
Great location. How does, and of course we've got just a short amount of time, we want to get to tomotherapy, which highlights y'all's cutting edge nature there of CRCC, but how do you all remain up to date on treatment options there?
Well, I think between the four of us, the physicians involved, we have I think a good professional rivalry where we each try to help stay one step ahead of the other. And we have regular conferences. We discuss all new patients under treatment during weekly chart conference, tumor conference at all of the hospitals that we work with, Grand Strand, Loris, Conway. And recently Waccamaw. And we all have our own subscriptions to the national journals and feel an obligation to stay up and stay current with all of that material.
Right. Great.
I feel I'm not doing a decent job unless I know what it is that's really current.
I love it. I like that internal rivalry between the four of y'all. That's great. Tomotherapy may have been prompted by some of that rivalry. This is something we can do that'll really, for all four, but it'll be very cutting edge.
Right. That was something where we've needed additional treatment capacity for a long time. We've had 2 operating machines. Our schedules were expanding from 6:30 in the morning till often 6 or 8 at night, just simply to be able to, we don't want to rush patients, we want to handle them properly, so you stay as late as it takes to get the job done.
Right.
But that's hard on the staff, it's hard on the patients. So when we made the decision to apply for what's called a CON, Certificate of Need, for a 3rd machine, we could have gone with the latest conventional equipment, which would have been very capable and allowed us to essentially do what we have been doing, maybe a little bit better. But there was a new device that had just come out within the last 3 years that was FDA approved very recently, and it's called tomotherapy.
Tomotherapy.
Right. And tomo means around or circular, so treating around. And essentially it's much like CAT scan, which stands for computerized axial tomography. You're acquiring a picture by circling the X-ray tube around the patient and then rebuilding the picture. And in fact, the tomotherapy equipment is actually built in a modified CAT scan gantry. So it's continuously rotating around the patient. A little bit of Italian here, I talk with my hands. But it actually is rotating around the patient so that it's treating not from 2, 3, 4, 6 different directions, but actually 50 to more, 50 to 100 different directions that we're treating small pieces that each adds together.
That's tremendous.
And by doing that, we can actually vary where we're treating. If we're coming through the heart, we actually want to reduce the dose, but once we're to the side of the heart, we can actually come in a little bit more. So it varies depending on what's between what we want to treat and what we don't.
Well, the basics of the different cancers that can be treated by tomotherapy, what would those be? And is this one of a kind in the area? Do many other places have tomotherapy machines? There's probably a pretty big ticket item.
It is, and that was part of the decision, was that it was substantially more expensive than a conventional machine. But what it allowed us to do was so much more. A good example is a patient recently who had a melanoma on the scalp. Elderly gentleman has had 2 operations already and has recurrence in multiple locations. So the surgery would literally involve grafting new skin onto the scalp, really without any good assurance that it wouldn't still come back with that. So that radiation was an option that the surgeon had asked if I felt was a reasonable alternative. And with the tomotherapy, we can actually shape the radiation field to follow the contours of the scalp, yet avoid the brain tissue underneath.
Right.
Perfectly ideal situation. Prostate cancer is another area where the additional benefit that tomo has is that not only can we refine the treatment field, but we can actually acquire an image while we're treating, so that with each pass of the radiation beam, there's also a detection array that can generate a picture just like a CAT scan. Tremendous. So we can actually acquire a CAT scan before each treatment with the patient on the treatment table. And if we need to make minor adjustments, we can actually compare what we planned and what we're treating and make those adjustments on the fly, so the patient is treated within literally millimeters.
That is tremendous.
So that we
what
can
an impact.
An example is somebody with a spine metastasis right next to the spinal cord. They've had radiation before. Previously, we'd often have to refer that patient straight to surgery because we couldn't afford the risk of harming the spinal cord and possibly damaging it and paralyzing the patient. With the tomotherapy, we can actually define where he's been treated before, or she, and define the treatment field so that we can exclude the spinal cord very efficiently and still treat the patient well. So it's opened up whole new avenues that we never had before.
That's tremendous.
And we're one of only 3 in the state, Spartanburg and Medical University in Charleston are the other 2.
That is fantastic. Great for the Grand Strand. And so you probably have folks coming in from the PD, from Eastern North Carolina, from all over.
We just started actually using the tomotherapy unit for patients. We've gone through 2 months of testing beforehand to make sure. So we've only been treating really in the last 2 weeks. And we already have, I think, 12 new patients on it. We expect to have it running at full capacity of 25 patients by the beginning of August.
That is tremendous.
So that's been a real boon for us.
Well, I'm embarrassed to say we've run out of time. I wanted to ask just some of those aspects of what could I do to try to stave off cancer. Is there anything that any one person, can they do it, or is this hereditary? But we'll have to get you back another time.
Good topic for another show.
I love it. Thanks so much for being with us this morning, Dr.
Thank
G.
you.
Have a great week.
My pleasure.
Stay tuned with a little more Carolina People with Dr. Paul Goetowski coming up next. One of only 3 in the state. One of only 213, not only nationwide, but worldwide, 213 worldwide. How did this tomotherapy machine end up in Myrtle Beach and serving this area? Clearly, the Carolina Regional Cancer Center's made a difference not only to their patients in being cutting edge, but making a difference in the entire community around in this area. There are going to be folks that are traveling in from all over. You heard Dr. G talking about one down in Charleston, one in Spartanburg, and now one right here on the Grand Strand. Carolina Regional Cancer Center, crccmd.com, crccmd.com, or give them a call, 843-449-9415. Take the time to learn more about this amazing organization and tomotherapy machine, cutting edge every day. Thanks so much for being with us, Dr. G.
My pleasure, Greg. Thank you.
Very definitely.